My name's Mellicent Blythe, and I'm an implementation specialist in an LCSW with the North Carolina Child Treatment Program. We are part of the Center for Child and Family Health in Durham, North Carolina, and are an NCTSN site. And our program is an implementation platform. We disseminate 6 evidence-based treatments for children for mental health and behavioral issues all across our state.
You've had to work with a lot of senior leaders across many environments, big versus small agencies, rural versus urban. Those implementing their first evidence-based treatment versus adding another EBT to several others they already offer. What approach do you take with senior leaders to help build readiness for evidence-based treatment implementation in their organization?
So we work with senior leaders through learning collaboratives. So we have groups, cohorts of senior leaders that are having clinicians trained in one of the evidence-based treatments that we disseminate. Within that senior leader track, one of the first things we do is we ask everyone on their team to take an organizational assessment specific to that evidence-based treatment, which I'm just going to refer to as an EBT. So we have an organizational assessment for each of our EBTs. We ask everyone on the team to take that. And in fact, if they have other already trained clinicians at their agency, we ask them to take it as well, so that each team has some feedback from their clinicians, from their supervisors and leadership about some of the strengths and needs for their EBT program. We share those results with the senior leaders, and for each site, we help them develop their own implementation plan or sustainability plan to address the goals that they have, the priorities that they have, and to overcome some of the barriers that they might have within each of their sites. So really trying to help them each develop their own goals, their own measures for progress, and their own tailored strategies to help them achieve those goals within their specific context.
And you mentioned the organizational assessment resource. Do you mind telling us a little bit more about that tool?
Yes, absolutely. So I can actually share an example of what that looks like, our organizational assessment. So you are looking at the example for our Sparks Learning Collaborative. And so as you can see, each agency has the scores from the beginning of the collaborative. That's sort of our pre-assessment. And then they have their scores from the end of the collaborative or our post-assessment on 7 different agency goals that we focus on. And these goals are the things that we talk about with senior leaders throughout the senior leader track. Within each of these goals, their staff are asked to answer some questions specific to that goal. And you can see we give them the average for their team. So we talk about referrals, we talk about organizational capacity, which includes resources and leadership development and leadership support. We talk about client screening and assessment, about family and client engagement, about supervision for the specific EBT, fidelity monitoring for that EBT, and then finally staffing for that EBT, because we know that selecting and hiring and retaining staff is, one of the biggest barriers sometimes to sustaining these models. So throughout the senior leader track, we're sharing resources and research and sort of peer-to-peer crowdsourcing for each of these areas as senior leaders are working on their own specific implementation plans.
Thanks for sharing that. Are there differences in how the organizational assessment process is carried out with agencies who are implementing their first EBT versus those who have implemented other evidence-based treatments in the past?
Yeah, there definitely are. I think what we generally find is that senior leaders tend to focus on those earlier goals that they really need to get their clinicians up and running the first time through. So they're looking at referrals, at resources, at screening and assessment. Those first three goals really take up a lot of the time and energy for new agencies. Once their clinicians they have their cases up and running, they're learning the model, they're getting, some new practices and policies and procedures in place, then senior leaders tend to be ready to look at some of those other areas of program development that are often, goals that they have anyway, not just because we're asking them to look at it, but because it's important to their program. So family and client engagement, supervision, fidelity monitoring, and the, staff retention and staff selection. Once they've come through once or twice, they often are able to dive a little deeper into those areas and really try to be creative in some of the strategies they might want to try out and some of the small tests of change they want to try.
Are there common challenges that senior leaders tend to face during this assessment and implementation period?
Yes, I would say one of the sort of initial challenges is once senior leaders have identified through that organizational assessment, they've identified one or two areas they really want to focus on, one or two priorities, they've set a goal in that area, then it's time to really think about what are the strategies they want to try to make improvement. And that can be hard, because I think in our fields, we tend to have go-tos that we turn to all the time. If there's a problem, we're going to do a training. If we need to let people know, we're going to send a big email, but those often aren't really specific enough. So, for example, we worked recently with a DSS agency and a wonderful senior leader who was trying to generate referrals in this EBT for her clinicians. And she, was emailing everybody what they normally do, sending out big emails to, dozens of people, and it was not working. And once she sort of thought through the barriers in a little more detailed of a way, right? What was keeping people from making referrals? Well, part of it was they weren't reading their emails, or if they read their emails on a Monday, but a kid came in on a Friday, they had completely forgotten what they were supposed to do. So she decided instead to actually go in person to the team meetings for each of the units within their agency, show up in person, explain again what they were looking for, and actually hand out a hard copy of, the criteria and what to do. And that's when they started getting referrals, right? It had to be a very tailored strategy based on the barriers in their setting. We also recently had a CDSA senior leader from a early childhood agency, same barrier, where they knew that there were kids out there that needed this early childhood EBT. It was child parent psychotherapy, but they were not getting referrals. And the initial thought was, let's do a training. But when they dug a little deeper, they realized, our staff already knows about this model. We've told them, we've given the brochures, but they're still not referring kids. So why is that? And what they realized was there was sort of this belief among their staff that it wasn't really their job to provide these services, right? They were a CDSA agency. They were supposed to be doing physical therapy and occupational therapy. They weren't a mental health agency. So they just didn't see themselves in that role. So what the senior leader ended up doing was actually using some of her champions. She got some testimonials and some case examples from staff who had referred clients who had had really amazing outcomes and really great developmental outcomes as well. And she started sharing those with the other staff. And, that's what sort of got people a little more motivated to make the referrals. So again, just, the same challenge of not having referrals, but real kind of different interventions, different implementation strategies based on those settings.
And those are really good examples of how you used tailored strategies to overcome those implementation barriers. Thanks for sharing that.
Yeah.
As we close out, what are some of the main points you want viewers to take away from this video?
I think we've mentioned our organizational assessment, which I should say that is really developed from the NCTSN Learning Collaborative Framework. that was the core, that's the core of what we use. We have added some items based on implementation research, especially some of the work of Greg Ahrens, and also from the Baker Center. They've done some great work in how they share their assessment data that we really love. But, it's not so much using that specific framework, but I really have come to understand why it is so helpful to have an implementation framework that you are using when you are trying to implement a new practice or a new treatment. Because, when you start a collaborative or when you start a new initiative, you're kind of getting bombarded, with like ideas and tips and emails and resources and links and PowerPoints, and all this information is coming at you and you're taking notes and you're writing things down, but things just kind of get lost. So the beauty of a framework is you have some buckets, you have some domains to start organizing not only your actual resources, but just your thoughts and how you are thinking about things, how you are planning. I just find really, really helpful. And I can tell it's helpful when, instead of having senior leaders sitting in a meeting, just like frantically taking notes everywhere, trying to capture everything that they hear, they're actually just kind of sitting and nodding and kind of checking things off and like making an occasional note here and there, because they kind of have the framework to fit things into. And then I think the other piece is those tailored strategies, is really thinking about, once you have your area of focus, how are you going to tailor what you're doing to the specific site, and not just kind of going with generic, this is what we always do, but what actually is getting in the way here, and how can we come up with a tailored strategy that's going to really overcome it. So I think those two pieces that we hear a lot about in implementation research, but I really feel like in a practical sense, they're extremely helpful when you're trying to bring in something new to an organization. And I'll say, if folks are interested in our organizational assessment, they absolutely can reach out to us through ncchildtreatment.org. But there are, dozens and dozens of wonderful frameworks out there that we know people are using and getting a lot of benefit from.